As urologic oncologists, we have a very unique role in the cancer landscape. I'm J. Ryan Mark. I'm a urologic oncologist at Fox Chase. I specialize in treatment of kidneys, bladders, prostates, and the cancers that develop. I'm extensively trained in pure laparoscopic and robotic surgery, but also extensive part of my training was with open surgery. Robotically, major cancer operations, we don't have to remove the whole kidney anymore. There's virtually no kidney tumor that you can't remove just the tumor. With modern robotics, we have the ability to save kidneys. Prostate cancer is very unique for men. There are a lot of quality of life outcomes, both urinary and sexually, that can really impact a man after surgery. We now have surgical procedures for the prostate where we're able to go into the prostate and instead of removing the whole thing, treat an area of the prostate. The technology that's improving is changing the way that we treat cancer rapidly. And you have to stay abreast of all that new information if you're going to offer the best treatments. For what we do in urologic oncology, Fox Chase has done groundbreaking research, which has led to a lot of the treatment guidelines. A lot of the paradigms for treating kidney cancer came out of this institution. And a lot of what we do now for bladder cancer originated here. Patients are doing better. The science is moving forward, and treatments are becoming much more specialized. We now have drugs that interrupt the growth of the cancer because of the specific genetic mutation that is allowing that cell to be a cancer. For patients who do ultimately need to have their bladder removed, everyone's familiar with the bags. New techniques, which can be done robotically, are to create new bladders out of available tissue in the body so that patients can experience a more normal quality of life after surgery. When I first meet a patient, I like to get to know them as a person. We follow our patients for a very long time. We now have very effective treatments for their cancer, so patients are surviving longer.
Mr. Bill?
So on our first encounter, we really need to establish a relationship. They're really trying to understand who the patient is, because we all want the same thing. We want to beat the cancer. And that's what people expect when they come to a place like Fox Chase.